So, if bariatric surgery saved your life, that's amazing. And I don't want to downplay that. However, the rest of what you're saying is not entirely accurate. First off, for you to say that the bariatric mortality rate is less than 2%, you must be taking the numbers from the first 2 years. When you go to 5 years out, the mortality rate for bariatric surgery patients is 5%. And that number doesn't take into account the number of people whose lives are shortened by things that are because of the bariatric surgery but aren't directly related. For instance, a cancer patient 20 years out from bariatric surgery, just diagnosed with colon cancer, the good kind, the easy to take care of kind. Only now they can't take as much of the colon out because that cancer patient already has a shortened digestive system. And because of the malabsorption issues deliberately caused by the type of surgery this patient has, instead of being able to take a 3-month course of chemotherapy, they have to extend it out to be a 6-month course. And over time, they discover that they actually need to start giving her infusions every 2 weeks instead of every week even, because because they have to give her chemotherapy 1 week and vitamin infusions the next week and hope that her white blood cells recover enough that she can undertake chemotherapy the next week after that. Which isn't always guaranteed. Another thing that they don't take into account when they're talking about those mortality rates is the number of times that a doctor, a non-bariatric doctor, basically kills their patient because they don't understand or don't believe their patient about the malabsorption issue. For instance, when I tried to tell one of my pain management doctors years ago that I couldn't take a time-released capsule, they were acting as if I was just having some sort of anxiety issue with it and that they needed to just calm me down and talk me into it. And I had to keep repeating that I had bariatric surgery, which means I cannot take a time-released capsule, while they were continuing to repeat that it will be fine, this is the only real treatment for this that'll work for this kind of pain, etc., etc. Like, they were not hearing me. Or when I was pregnant and they give you that carbonated orange sugar drink to try and test your blood sugar, and they tried to tell me that I needed to drink it in 5 minutes, and I was like, there's not going to be a way I can drink that amount of beverage of any kind in 5 minutes, but especially not a carbonated kind. I did figure out a way to flatten it, which meant that I was able to get more of it into my system, but they just were like, do your best, and they were sure that I was going to be able to drink the whole thing. And they were surprised when I had almost a third of it left. And again, they acted as if I was being uncooperative rather than them, asking me to do something that's not possible for a bariatric patient. My friend was like 6 years post-bariatric surgery when she went in for something unrelated. I think it was a broken bone, and they gave her an NSAID. And she didn't recognize it that was a problem, but I was like, wait a second, is that a non-steroidal anti-inflammatory? And they were like, yeah. And I was like, she had bariatric surgery, she can't have NSAIDs. And they started arguing with me. And I've even seen nurses on this app, who are basically making fun of patients who say that they cannot have NSAIDs. When you can't have NSAIDs after a bariatric surgery. But they don't count any of those complications and deaths as results of bariatric surgery, even though they are 100% a result of either the malnutrition or the issues that you have then after bariatric surgery. And the funniest thing, in a bad way, is that the bariatric surgeons try to make it sound like it's all your fault if you don't communicate with your doctors correctly about NSAIDs, and if you take the NSAIDs, then it's your fault that you have complications from it, as if doctors listen to fucking patients. I had to become okay with being the broken record, uncooperative patient, because none of my doctors were listening to me when I kept saying, I can't take this, I can't take this. Even my ex-husband, used to say, well, it's because she's not taking the medication. And I wish I could just bottle that sort of the way that it infuriated me, because he knew why I wasn't taking the medication, but he dismissed it too, even though it was in the paperwork that we went through together. And lastly, I'd like to tackle just a little bit of a tackling of this last quote here. Almost 100% of morbidly obese individuals' lives are shortened by over 20 years. That is questionable at best. The statistical model that they used in order to get that number had to be twisted so far out of any kind of mathematical or scientific realm that it's just impossible to prove. And they're conflating all of the comorbid conditions that often, but not always, not even close to 100% occur alongside obesity, as being caused by obesity. And what they're finding out is that a lot of those disorders actually just have the same underlying cause as the obesity. For instance, there are a couple of studies. Now, these are small sample studies, so they haven't proven anything yet, but the results are suggesting that the obesity does not cause type 2 diabetes. The obesity and the type 2 diabetes may be caused by the same underlying problem. And that's just one of dozens of things that are supposedly caused by the obesity that may actually not be. They may have the same underlying cause as the obesity does. Like, we have spent so much of our time and energy in blaming the obese people for their weight that we never bothered to actually find out if there could possibly be an underlying cause.